It's one extra step in fighting the opioid addiction crisis.
A pharmacy chain plans to tighten up its policy for filling prescriptions for painkillers. Meg Ferris explores the problem with the top local drug enforcement agent.
Beginning February 1st, pharmacy giant CVS will have certain time and patient restrictions when it comes to filling painkillers. That comes on the heels of Louisiana also putting 7-day limits on some opioid prescriptions.
We are in a grip, an opioid crisis grip in our nation.
Special Agent in Charge Stephen Azam for the New Orleans Field Division of the Drug Enforcement Agency sees the devastation of addiction to opioids every day, including prescription painkillers and heroin.
We find ourselves today in this heroin epidemic. I've never seen anything like this in my career, in my law enforcement career, 30 years.
Nationwide, in 2015, there were 52,000 overdoses. In 2016, projected to be 64,000 deaths. And in 2017, overdose deaths are expected to rise to 70,000 people. Around 70% of those are from opioids. That would nearly fill the Superdome. And in Orleans, in the last few years, EMS has used the life-saving drug Narcan 3,500 times to get an overdose patient breathing again.
Last year, you had more overdose deaths in Orleans Parish than you had homicide deaths.
For many, the addiction and even the move to street heroin started innocently with a painkiller prescription after a medical procedure or injury. It's especially dangerous for the young, whose brains are still developing. Two different parents who didn't feel comfortable going on camera told us that they were shocked when each of their teenagers who recently had their wisdom teeth out were given a large prescription for painkillers, opioids, one as many as 30 pills. That's even more surprising since nationally, oral surgeons like Dr. Michael Block of Metairie are decreasing the number of opioids they prescribe.
I tell you, ibuprofen is better than the narcotics. That's well documented.
Along with its investigations of drug dealers and illegal practices by some pharmacies and doctors, the DEA is on a mission to educate the community, parents and healthcare workers too. Agent Azam says it's time to wake up.
We have a long road ahead of us, and I think we are moving in the right direction.
Meg Ferris, Eyewitness News.